My name is Carrie Nieman. I'm an assistant professor in the Division of Otology, Neuro-Otology, and Skull-Base Surgery in the Department of Otolaryngology, Head and Neck Surgery here at Johns Hopkins University School of Medicine. I'm an otologist, which means that I'm an ear surgeon. I take care of patients both from a medical and surgical perspective on everything that has to do with the ear, whether that means balance problems, problems with the eustachian tube, or hearing problems, including surgical restoration of hearing, such as cochlear implantation. Communication is the foundation of the human experience. It is something that motivates both my clinical practice and my research. As a clinician scientist, my work focuses on understanding hearing healthcare disparities among older adults and community-based approaches to address those disparities. Over the past 10 years, we're beginning to learn a lot more about the impact of age-related hearing loss on how we age. In the past, we thought about age-related hearing loss as really just a benign part of the aging process. But now we're beginning to understand that it may have a significant impact on how well we age. So when we talk about access to hearing care, like hearing aids, we're not really just talking about access to hearing care for the purpose of addressing hearing or communication, but we're talking about it as a potentially essential tool to aging well. My goal as a clinician scientist is to ensure affordable and accessible hearing care for all. My care philosophy is the same philosophy that I bring to my research. The core of the doctor-patient relationship is partnership. We each bring expertise, and that partnership extends beyond the patient-doctor relationship. Partnership extends to what we do across departments, across disciplines, and across institutions. That's how we bring the advances of science and medicine to each of our patients. And that same partnership, if we extend that just a little bit outside the box, is how we innovate, it's how we advance, and it's how we change the practice of medicine and public health.